Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we focus on a hidden population, youth who care for chronically ill, injured, elderly, or disabled family members. Connie Siskowski is founder and president of the American Association of Caregiving Youth. Julie Belkowitz is a pediatrician at the University of Miami School of Medicine. They talked to Dr. Josh Sharfstein about who these kids are and what they need. Let's listen.
Dr. Siskowski, Dr. Belkowitz, it is great to have you both here on the podcast to talk about the issue of caregiving youth. Dr. Siskowski, I'd like to start with you. What do we mean by caregiving youth?
Well, Josh, first of all, thank you for having us to help raise awareness about this otherwise hidden population of children who are providing care for family or household members who are chronically ill, elderly, disabled, or injured. And as a result, they sacrifice their education, their health, their well-being in childhood. They are essentially an invisible population.
How did you become involved with caregiving youth? How did you start to see them?
Well, I was a caregiving youth when I was in middle school, and the trauma that I experienced affected my life as an adult, not professionally, but personally. And so I went to the first international conference on family caregiving in London in 1998, and it was there that I learned about what they call young carers, where the UK has been supporting them. So when I went back to school to get my PhD, my dissertation looked at children in Palm Beach County who were in middle and high schools who were in this role. And the results were remarkable, much more robust than anyone expected, with about a third of the kids either missing school, not doing homework, having trouble focusing, or some combination of both.
So you looked in just one county. How many caregiving youth do you estimate there are in Palm Beach County?
In Palm Beach County, we know that there's more than 10,000. In the state of Florida, we know that there's more than 290,000 public, middle, and high school students who are caregiving and being ignored by the system.
Dr. Siskowski, could you talk about some of the common scenarios that you see in terms of caregiving? What are young people doing in terms of caregiving? What does it look like?
The caregiving that they do really varies. So if you're caring for a sibling who is disabled or perhaps on the autism spectrum, those responsibilities are different than if you're caring for a grandparent who may get up in the middle of the night and wake you up, and you worry about, what's going to happen if they die. If you're caring for a parent, particularly a single parent, you may need to be giving them medication. Somebody who has memory care issues, you need to make sure that any equipment that they need, that they don't wander, that they're well protected. The responsibilities really vary with the situation.
But it sounds like it's the full range of caregiving.
Absolutely.
Dr. Belkowitz, you're a pediatrician at the University of Miami who has worked with caregiving youth. I'd like to bring you into the conversation.
I think it's important for people and your listeners to understand that caregiving youth are really taking on the exact same responsibilities as adult caregivers. And while adult caregivers have a lot of recognition for the responsibilities that they take, bathing, toileting, dressing, providing support at medical appointments, managing medications, providing emotional support. These are things that kids are doing silently without anybody really even knowing that it's going on oftentimes.
Are there any particular examples, Dr. Belkowitz, that come to mind that kind of help bring to life this challenge for a young person?
I think one thing that really has struck me is we did a study a few years ago. A student of mine did focus groups with children who are managing medications. So it turns out over a third of children are managing medications as a part of their caregiving responsibilities. And there's tremendous challenges that these kids face as they're taking this on, making decisions about what medications to use, worrying about if they did things right, learning how to do their different responsibilities and who's training them to do that. So if you think about a young child in middle school, high school, even younger, making these very complex decisions with significant responsibilities and potential impact on their loved one's health, you can imagine the great toll and burden that this can place on kids.
Thank you. Dr. Siskowski, what do these kids need?
The kids need a variety of support, and one size doesn't fit all. So some may need support academically. Kids need respite too. There are many programs to support adults who are family caregivers to give them a break, but there's nothing for children. Kids need to be a kid. They need to have activities. They need to know that they're not alone, and they need to know that they're appreciated and valued for what they do.
Now, your organization runs one of the only programs in the country focused on caregiving youth. What do you do to help them?
So it's true. Our program is the only one that's dedicated to the whole gamut of kids caring for people with various illnesses. So we work in school to provide them with basic life skills and skills building. We do lunch and learn sessions. We do individual coaching because caregiving is one thing that differentiates them from their peers who are non-caregivers. We do a home visit, which is super important because often we can find things that can ease the stress on the family. And if you can ease the stress on the family, then you can reduce the stress on the child. So that, for instance, if a child and his single parent is lifting his brother in his wheelchair up and down the steps, and he has to be home when his mother gets home from work to get him into the house by building a ramp, then you ease that responsibility from the child. And then we do fun activities to give them a chance to meet other kids because first they think, I'm the only one who's doing this. And then they learn that they're not the only one, even in their own schools, even across the street. Because again, kids don't talk about this. Families are afraid. And educators, as well as nurses and social workers, have not been educated. It's not in the curriculum. It probably wasn't in your curriculum. And I know it wasn't in mine at Johns Hopkins.
Well, Dr. Belkowitz, what do you see when kids get this kind of support?
I'm glad that you asked that question because while there are a lot of potential challenges for caregiving youth, there actually are some benefits that can be seen in kids, especially when they're supported. Children who are caregiving demonstrate a great sense of maturity. They often describe pride in the work that they're doing. They show resilience. Dr. Siskowski's kids, a lot of them actually end up going into healthcare professions because of the impact of this responsibility. So when children are supported and recognized, there can be a lot of opportunity to help them thrive despite the challenging situations that they may be in.
That is good to hear. And it makes me wonder whether programs like yours in Florida can be spread to other places. What's the national picture look like, Dr. Siskowski?
I wish the national picture was brighter than it appears to be right now, because essentially these children are suffering from reverse age discrimination, where there are supports for adult family caregivers. There's not the recognition and support for kids, as there is in other countries. So I think we need to develop some national policy on their behalf. I think states that already have some organized structures for family caregivers should include caregiving youth. I think the CDC should include a question on caregiving in all of their youth risk behavior surveys in every state so that we can get a better handle on the data, because there has been no national data released since 2005.
I think that national prevalence survey is a really important piece of this, because until we can really quantify the number, we're going to struggle with identifying the right supports to bring in the resources that we need for these kids. So really helping us to count these kids, identify them, will help us to bring all of the other things that we need to create a national strategy to provide supports for children in schools and healthcare and wherever they may be.
And even though our work began in Palm Beach County, people said, Palm Beach County, there's no caregiving youth there, especially in Boca Raton, and how wrong they were.
Which makes you think they're everywhere.
They are everywhere.
Dr. Belkowitz, how do you think the pediatric community can better support caregiving?
I think there's different ways that pediatricians and the pediatric community can look at this. Number one, on the individual level, as we said before, pediatric healthcare providers, pediatricians, nurse practitioners, who's ever working with kids need to ask the questions. So if a kid comes in and in your family history, you find out that the mother has cancer or they live with the grandmother with Alzheimer's, follow up that next question and say, oh, what role do you take in caregiving, or how do you support your loved one? And just that recognition will go a long way for kids to know that this isn't something that they should be ashamed of or that nobody will believe that they're doing. On the community level, I think our organizations need to come together, again, to make specific recommendations, to describe best practice, how to screen for this in the practices, make recommendations that we should be including this as a part of our routine health supervision. And I think pediatricians need to join on board in the advocacy for legislative support that we've been talking about.
What about people who aren't pediatricians or nurse practitioners, but they want to support caregiving youth? Dr. Siskowski, what would you tell someone who's listening to this podcast and says, wow, this could be happening in my community, but I want to help?
Well, I'd like to say it is happening in their community, and it's not up to pediatricians alone, because what happens when children go to help translate or help get a parent to a procedure, and it's a physician who provides adult care, they too need to know about this population and recognize them.
Is there a role for just the general community to be supportive here?
There is. Right now, we have many adult family caregivers who are no longer in that role. And so they know some of the nuances and what it's like to be a family caregiver. Organizations, congregations. We have a mentoring program. Mentors can be really significant in the life of a child who perhaps is losing a parent or who doesn't have a parent. There's just many ways to support them, including financially.
I also think that children don't only go to school, don't only go to the doctor's offices. So as much as our religious institutions, community organizations, sports clubs, all of the different places where children are found, that people are thinking about these kids and recognize these kids, is going to help raise awareness overall and, again, make the children feel like they're a part of the communities around them.
If people only knew about this, why would they not support this population? Because it's a great investment. Because if a child drops out of school and our high school graduation rate is 98.1% average over 9 years, what happens? There's more teen pregnancy, more disease, more crime, lower taxable income, and more system dependency ultimately. So it's a great ROI.
Sounds like you've got a message for the whole political spectrum.
Do we ever?
Well, thank you both for joining so much. I learned a tremendous amount. I kind of wish I had learned this a long time ago, but it's never too late, particularly when there's such an important population at issue. And so thank you both.
Thank you, Josh.
Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.